How can I ensure a clear brain scan for stroke? When it comes to diagnosing a stroke, getting the clearest possible brain scan is crucial. The first step is choosing the right imaging test. Usually, a non-contrast computed tomography scan is used first because it quickly rules out bleeding in the brain and can identify major infarctions. It's fast, widely available, and highly effective in emergency situations. If more detail is needed, especially to detect early ischemic changes, magnetic resonance imaging with diffusion-weighted imaging is more sensitive and can pick up small or recent strokes within hours of symptom onset. Sometimes, additional scans like computed tomography angiography or magnetic resonance angiography are used to look at the blood vessels, helping doctors decide on treatments like clot removal or clot-busting medications. Preparing for the scan involves proper patient positioning. For a computed tomography scan, the patient should lie flat on their back with the head securely supported in a head holder to prevent movement. The scan is aligned parallel to the base of the skull to reduce radiation exposure to sensitive areas like the eyes. For magnetic resonance imaging, patients need to be screened carefully for any metal implants, pacemakers, or aneurysm clips, as these can interfere with the magnetic field. All metal objects, including jewelry and hearing aids, should be removed before the scan. Staying still during the procedure is essential because movement can cause blurry images, making it harder to interpret the scan accurately. Sometimes, sedation might be used if a patient cannot stay still, but this decision depends on individual circumstances. Minimizing motion and artifacts is key to getting a clear image. Patients should be instructed to relax and remain as still as possible during the scan. Using head supports or restraints can help prevent involuntary movements. It's also important to avoid delays or repeated scans, as these can cause discomfort and increase the chance of movement artifacts. When contrast agents are used, such as iodinated diforcourt or gadolinium for MRI, the medical team will evaluate kidney function and allergies beforehand. Proper screening ensures safety and helps prevent adverse reactions. Contrast can improve the visibility of blood vessels and brain tissue, but it must be used carefully. Timing is everything in stroke diagnosis. Imaging should be performed as soon as possible after symptoms begin to maximize the chances of detecting the stroke accurately and starting treatment promptly. Standard protocols often include a non-contrast court scan initially, followed by additional imaging like perfusion scans or vascular imaging if needed. This rapid approach provides comprehensive information without delaying urgent care. Follow-up scans might be necessary if the stroke evolves or if initial images are inconclusive. Effective communication between the stroke team, radiologists, and technicians is vital. Patients should be transported quickly and safely to imaging facilities. Clear instructions about the specific imaging sequences and protocols should be given based on the clinical situation. This coordination helps ensure the images obtained are of the highest quality, enabling accurate diagnosis. In summary, ensuring a clear brain scan for stroke involves selecting the appropriate imaging method, preparing the patient properly, minimizing movement, using contrast safely when needed, and following standardized protocols for rapid, high-quality imaging. These steps are essential for accurate diagnosis and timely treatment, which can significantly improve outcomes. Always remember to consult healthcare professionals for personalized advice and care tailored to individual needs.